sometimes including labia majora and minora when it gets to severe extent. But most commonly it is involving the clitoris. Now this is done in communities and societies that believe that the clitoris gives impetus to a woman to become promiscuous, that makes a woman to be promiscuous, to move from place to place, and so it needs to be trimmed, and they go on trimming it.
Sir, another question is, sir, does it have any harmful effects on the females who does it?
Of course, yes. And that's why we have been advocating. And I think the advocacy is yielding good fruit. We have been advocating for this topic of genital mutilation because it produces scarring of the vagina, which at the end leads to constricture of the vaginal orifice, and during delivery it could prevent spontaneous vaginal delivery, which can lead to unnecessary cesarean section, or sometimes it could even be scarification in such a way that may allow the head of the fetus to come out, but with a resultant tear, which will lead to dangerous presentation of the vaginal, female vagina. It also could lead to genital mutilation, excessive extirpation of the vaginal external genital to a level that makes the woman poorly acceptable by a male, especially during intercourse. It causes bleeding during the immediate action, mutilation, causes infection, and leads to death.
Sir, does it have any advantage on the female? Like, does it add anything to the female?
Well, not of anyone I know. I don't know of any advantage it has. Sincerely, I don't know of any advantage.
Well, sir, as a medical practitioner, what do you advise like should be done to stop it in those societies where they see it? Because there are some societies who
it goes with culture. And anything cultural takes a gradual process to be overridden. So we continue on advocacy, mobilization, education of communities, telling them the disadvantage of doing this and providing them enough knowledge that can enhance their desire to stop.
Alright, so finally, you've contributed in the past to the campaign against drug abuse. Your video is trending on wasuponline.org about drug abuse, and now you are contributing again about the disadvantage of female genital mutilation. What other areas do you think youth and student organizations like the ECOWAS West Africa Student Union can also advocate as a student youth body? What other areas should they also look into that affects the youths and the upcoming generation?
Well, areas in terms of health, is it?
Yeah, in terms of health and general. As a father, you're not just a doctor, you're a father.
Okay.
Yes.
Well, yes, there are many areas that the youth are involved in. Violence. I think that is something that must be done away with. The youth is an active person, and Most of the times, because of redundancy, the youth is without any job to do, so it's a common tool in the hands of those who want to cause or foment trouble in society, especially the politicians. And because the youth is not looking forward to an ambition, so he keeps himself or herself open to these persons that want to readily use them to cause trouble, especially the politicians, the persons who want to make money at all costs, and in fact those who want to make name in a wrong form.
Alright, so finally, will you be open to attending Wasup conferences to speak to people outside Nigeria?
For sure.
Okay. Alright, thank you very much, sir.
You're welcome.